Governor, the question about the George Wiley Center was specifically about people who had their power or utilities shut off before the pandemic, not people who are can't pay their bills now, but this is about people wanting to restore who can't because of the economy. Do you have a answer on that?
Say it again, please.
The George Wiley question was about people who did not have their utilities before the pandemic began, not about people who might be shut off now. So there are people out there who still don't have utilities because they cannot afford, under the present pandemic, to get their utilities restored. And that's what the governor of Michigan did with his executive order. So I think that's more the gist of what George Wiley Center was trying to ask.
Got it. Okay, I'm sorry. I didn't follow that. Thank you for bringing that to my attention. I don't know if I have the executive authority to do that, or maybe I'll go through the PUC. So let me look at it and get back to you.
Thank you.
Governor, to what degree is there an investigation or some kind of look into what's been happening at Golden Crest and Oak Hill to give families an answer about what's happening there and what may have caused the problem?
Yeah, there is ongoing work 24/7, really, with the nursing homes. As I shared yesterday, we have pushed out resources to supporting the nursing homes with the infection control practices that are needed, the additional testing that's needed, support with cohorting, as well as the workforce strategies. No one particular nursing home has done anything differently that leads to these unfortunate outcomes. It's really the presence of this virus in a congregate setting among a medically and physically fragile population that sets up for these challenging outcomes. And if it weren't Golden Crest, it could be another nursing home similar to what has been experienced in Seattle and other cities and states throughout the country. We are working as hard as we can to prevent further nursing homes from going down this path, knowing that that is possible as well.
Brian, I would just say, from my perspective, it is sad and tragic. Nothing that we have uncovered so far would suggest that it merits, to use your word, an investigation, similar to what's happening in the Veterans Home in Massachusetts.
Right.
The data in terms of number of infections, number of deaths per size population is sadly is similar to what you're seeing in nursing homes all over the country.
And I'm sorry, could I just do you have a breakdown of the unfortunate the deaths today, the 3 in nursing home settings where they were?
I do. There was one at Orchard View who was in their 80s, 2 at Oakland Grove in their 60s and 80s, and then the additional congregate setting is one at Access Point, the person who was in their 70s, which is a facility for people with differing abilities.
Thank you.
Governor, following up on my question on testing, this is Michelle Smith. Do you have everything you need other than the reagents, or are there other things that are hindering the level of testing right now? You had said last week, I think, you didn't have enough test kits for the Abbott machines. Do you have swabs, PPE? Do you have staff for the test?
Yeah.
To do the test?
Yeah. Sorry, good question. We're in good shape on swabs. We're in good shape on equipment, the machines. We're in good shape on people because we're mainly using the National Guard to help that. Where we need the help is the test kits. So, and most specifically, there's 2 problems. One is it's still a struggle in the private market.
Well, I know, I realize that.
Access enough of the kits and reagents that we need, like from Roche and Abbott and the other diagnostic companies. But the other thing is, last Monday, we received, like every state, 15 of the fast Abbott machines from FEMA, from the federal government. The machines, we were told by the White House that we were going to get 15 machines, and each machine was going to get 150 test kits, but they instead sent 15 machines and 120 kits, and we still haven't seen more kits. So it's the disposable portion on Abbott and all of them that we struggle to obtain.
Can you
Governor,
order
with
those
respect to
directly from Abbott, or are those not available? You're not able to get them?
Obviously, we're trying. We're trying everything. We're trying direct from Abbott and Roche through the government. You know, we have orders and requests everywhere. The challenge is getting them filled. I mean, the problem right now is if you call Abbott to try to order, they tell you they're, and I'm not picking on Abbott, XYZ company. If you call any company and try to order, they tell you we're prioritizing the federal government. If you call the federal government, they tell you go call XYZ company.
Governor, any thought about regional testing with a new working group, or kind of pooling resources on a regional basis from antibody testing, whatever, other than opening up the economy? Are you working with the other states?
We have tried to collaborate around like bulk purchasing for PPE and the like.
Well, it's better than the dogs the other day.
We haven't done anything. I don't think we've actually made any joint purchases. We worked with Massachusetts, the Crafts. We've done a little bit with Connecticut on a PPE purchase. So we talk all the time, and we try to help each other is the short answer. There's no, like, official program.
Governor, this is Tom Mooney with the Journal. I was just curious what your reaction is to the concerns raised by GOP lawmakers concerning tracking of COVID patients with their cell phones.
Yeah, look, I think they're valid concerns. What we are forced to contemplate here is unusual and, you know, difficult. And so we have to be careful to meet the needs of the public health crisis without violating anybody's civil liberties or civil rights. We are in close contact. The Civil Rights Division of the federal HHS has put out new guidance as to how we should handle privacy and data, and we're hewing closely to that. I think, you know, most especially, this will always be opt-in, so we're never going to force anybody to do this. It'll be an option for each individual Rhode Islander to choose. So we're taking a very careful, measured approach to walk that line of making sure we keep everybody safe, but also protect people's rights.
Governor, you've indicated...
This is Paul Parker from the Providence Journal. Could you repeat the contact tracing numbers?
I think we ended up talking over each other. I was going to follow up on the cell phone issue.
Can I please answer Paul's question? And then
Sure, I'm sorry.
Whatever that was. So in the last 14 days, we've reached out to just over 2,800 people who've been in close contact with someone who has a virus. So on any given day, Paul, we are talking to somewhere between 200 and 400 people who've been in contact with somebody who's tested positive. And right now we have about I have a team of 100 people, combination of Department of Health and National Guard, doing nothing but contact tracing.
The number somewhat shocked me. 2,800 seems low given the multiples we heard in the first days of March. Can you help rectify that?
Well, that's only been in the past 14 days, so I could go back and get you the full data from the beginning of March to now.
But I mean, in March we were hearing like 50 or 100 people per infected person. That would seem to be much higher, or was that just inflated in the early days?
I wouldn't say inflated. I know we were reporting out who was being quarantined, and I'm not sure if that is the number that you are referring to. We do have sort of estimates of what can happen when you're reaching out to the contacts of people who are cases, and that number can vary. So we can certainly look back to see more about what was shared and what it was based on, but what the governor shared is what we have most accurately now as we are expanding the contact tracing program.
Well, we can go figure out, I think you're asking, like, on average, how many contacts per person do we touch? So let me get you a better answer and come back to you.
Thank you.
Doctor, can you provide?
Governor, I was asking about the cell phone tracing earlier.
The data updates. Some of them haven't been updated since the by count hasn't been updated since Friday. By sex hasn't been updated since Saturday. Will we be seeing updates on those data points once a week or every few days?
At least every few days. I know a team of people are working very hard to get us to a daily update place once there are enough numbers to reflect the change. So we'll keep pushing that.
Governor, on cell phone tracing, you've indicated in the past that you were using cell phone data, at least in the aggregate, to measure things like compliance and people moving around. What's the source of that? Is that commercially purchased data, and to what extent does it or could it indicate or identify individuals?
I don't know if I know it's publicly available, and it's all data in the aggregate, so there's zero ability to identify individuals. Whether we purchase it is a question I need to have Jen get back to you on.
All right. And what is the state doing exactly in terms of trying to find an app that people, and so you've indicated that would be opt-in, and that's interesting to hear. So the app, whatever it is, people would be encouraged to install, and whatever tracing it did would be therefore entirely voluntary because they chose to install the app.
Exactly.
This is Michael Dorff.
Exactly.
One question
or there would be, different functionality in apps, that you could choose to accept or not.
One question.
What about members of the public that don't have a smartphone or any way to download an app? Would they be provided with a cell phone?
Whoever is talking, if you can please mute your phone if you're not asking a question.
Someone repeat that question. I couldn't hear it.
Certainly, yeah. The question was, so for members of the population that don't, the Rhode Island population that don't have a cell phone, don't have a smartphone, would they be, but want to opt in to the app? Is there a way for them to get a cell phone?
We have to cross that bridge when we get there. It's an excellent question, and I don't have a great answer right now.
And we often have creative ways that we work around where folks may not have access that we would be implementing in this situation as well.
Governor or Dr. Steff, has there been any slowdown in the number of people who are signing up for appointments at the testing, or are you still basically maxed out at the 1,800 to 2,000? I know yesterday they were closed, but have you seen any trends there? I know you put out the word again to have primary care folks make appointments. What can you say about the number of people?
Yeah. It's been a little weird because Sunday was Easter Sunday, and then Monday we had to close. So I would feel better answering that, Thursday, Friday. But so the short answer is yes, we've seen a slowdown because yesterday we were closed and the day before that was a holiday. I don't know if it's the weather and the holiday or if there's something more to it, so we got to wait a few more days. But we are
can
I say one more quick thing? One of the things that we rolled out, which is worth noting, we haven't really talked to you before, is when we first started this, like a week or two ago, physicians had to fax in appointments, and it was a really kind of kludgy, unsophisticated system. Now, due to Salesforce, it's all like an online ordering system, and we have 900 physicians on the program. So I really do want your help continuing to push it out. Like, physicians, it's easy. You don't have to use the fax, and send in your orders. I'm sorry, what was your question?
Oh, I was just going to say, so the people who should have had appointments yesterday, those are supposed to be now today, is that correct?
Yeah, they all are today. They all got rescheduled for today.
And as we're finishing, I wanted to clarify the mention I made during the press conference about the EO on face coverings. It is for customer-facing businesses as well as for office-based businesses, manufacturers, and nonprofit organizations as well. So we want to make sure that it's clear the executive order is referring to all of those scenarios.
Dr. Alexander Scott, who wouldn't be covered then if it's offices, manufacturers, retailers? That sounds like most everybody.
That's right. It is pretty much everybody. Like I explained, we're going to have to make some exceptions. Like the example I used is for call center people. You can't do your job if your job is to talk on the phone all day and wear a mask. There's other jobs like that. So in those cases, we have to work with them to say, okay, fine, you don't have to wear a mask, but everybody has to be 6 feet apart. So we'll work.
Do you want to see?
We want to work with employers, but pretty much this is for everybody.
Do you want to see reporters wearing them in the field when they are just doing their regular live broadcasting versus interviews?
Well, I think if you're trying to talk into a microphone, that no. But when you're out doing your work, like the cameramen and the AV people in the stateroom all have their mask on. But obviously it's hard to do your job if you can't talk.
Okay, everyone. Thank you for our time today. We'll be back tomorrow.